Good day, everyone. Good day, Ma'am Carmi. I am Kim Huevos, and today we will be presenting a case about hypothyroidism. Along with me are my group mates, Nicole Alamillo, Princess Hannah Alano, Aubrey Joy Araza, Kooleen Ann Avena, Marielle Dayandante. So for the patient's biographic data, her name is patient HC, lives in Caloocan City, 30 years of age, female engineer, a widowed, Roman Catholic in religion, is a college graduate, born in Quezon City, belongs to the Tagalog ethnic group, and has a parity of 2. So for patients' nursing health history, the chief complaint was, as you can see, my face is very puffy, but I do not feel any kind of pain. But I feel cold and I've been having constipation for 3 days as verbalized by the patient. So for the reason for her visit, patient H reason for visit is having puffy face, hypothermia, and constipation for the past 3 days. So for the history of present illness, several days before admission, the patient felt uneasy and started shivering while reviewing some of her paperworks, which resulted in her being hypothermic. She also noticed that her periorbital area was starting to swell. So for the past history, the general state of health, patient H was born on January 19, 1991, a Roman Catholic and lives at Caloocan City. The patient was requested to undergo blood tests T3, T4, and TSH. She was also required to have a thyroid biopsy. So for her family history of illness, as we can see in the table above, most of the members in the paternal, the grandmother, grandfather, aunt, mother, and father went on a camping trip and got caught in a forest fire at the age of 75, 77, 22, 40, and 44 respectively. Her grandparents are married and living in the same household as well as her aunt and both no history of illness. While on this maternal side, her grandfather died at the age of 60 due to a car crash when he was on a public transport. Her aunt also died of heart attack at the age of 78, while her grandmother died of tuberculosis, which she acquired from her friend and died at the age of 90. Her other aunt, 62 years of age, is still currently alive with no health issues. Patient H's brother died of heart attack at 40. Her husband, a seaman, was reported abducted at a pirate encounter at the age of 39, while other brother, 56 years of age, is still living up to this date.
So in patients' age, patterns of functioning, so the health perception and health management pattern of patient age is conscious about her health and that she started that her health was fine until she started working as an engineer. So according to her coworkers, patient's overall appearance is good, but her face is puffy and the area around her eyes appears to be swelling. So during hospitalization, patient is still conscious about her health condition and she becomes more aware of the importance of learning about the impact of her occupation on her health. Therefore, many factors influences health. So according to CDC, one of the health determinants is called environmental factor. And after learning about the factors affecting patient age health, the patient displays a normal calm and relaxed mood. In nutritional metabolic pattern, so according to her coworkers, she was a healthy person with her lunches includes leafy vegetables. So upon admission, patient H reports that she doesn't have any appetite and also she feels bloated and uncomfortable lately. So during the hospitalization, patient H registered dietitian advised her to consume iodine-rich foods such as seaweed and foods containing iodized salt. So unlike before, patient H says she feels a little more at ease and has a voracious appetite. So therefore, the patient eats healthy food prior from hospitalization and patient has an iodine deficiency regarding to the insufficient thyroid hormone production. Next. So the elimination pattern of patient H is that she defecates on a regular basis. However, upon recently she has had difficulty defecating, and at the time of admission, the patient has dry hair and dry scaly skin. So during hospitalization, the nurse assessed patient's H hair and skin if it is still dry. And patient H still has some difficulty defecating, however, it is not bad as it used to be. So therefore, the patient is experiencing dehydration. Inactivity exercise pattern. Before hospitalization, patient H works out every morning by walking, biking, or jogging. Upon admission, she reports a recent lack of desire to exercise. So during patient H hospitalization, she appears to be in good health, expresses interest, and becomes active. And every morning, patient walks through the hospital halls. Therefore, according to the current study, thyroid functions improve in hypothyroid patients who exercise regularly as TSH levels decreases and T3 and T4 levels increases. So in sleep rest pattern, patient H claims that she always sleeps with the air condition on. So before hospitalization, she complains about not getting enough sleep, and according to her friend, that she observes that patient H has a dull facial expression, droopy eyelids, and appears tired. So during the hospitalization, the nurses schedule a sleep for at least 8 hours, and patient was given a comfortable bed by the nurse. Also, the nurse ensures that the patient has the opportunity to rest in a dark, soothing environment, and also the patient is given levothyroxine to replace thyroid hormone. So therefore, patient is now getting a good night's sleep, feeling at ease, and the hormone replacement therapy is prescribed for the symptoms such as fatigue that should actually or gradually fade. So the cognitive perceptual pattern, patient's sensory perception is unaffected, although patient is having difficulty speaking and is disoriented in her daily life. So during the hospitalization, patient still has having difficulty communicating with healthcare professionals about decision making. And patient is aware of time, place, and situation. So therefore, the patient is alert and attentive, but his slow speech makes it difficult to answer questions about his health status. The self-perceptive or self-concept pattern of patient is that she is conscious about her health. Upon admission, the patient demonstrates a lack of self-care as evidenced by a forgotten pair of shoes, and patient H claims that she has less time for herself. So during the hospitalization, nurses assess patient H activities of daily living efficiently and cautiously. And also, the nurse allows the patient to have regular routines and gives the patient enough time to complete the task. And therefore, patient H self-perception of her health status is conscious at first, but as her treatment progressed, her self-esteem grows and she feels relieved. Next is the role relationship pattern. So before hospitalization, she has a positive relationship with her daughter, son, and other family members. So the patient's daughter is the one who financially supports her and cares for her, and there is no disagreement between them. During hospitalization, patient claims that her daughter and son work with healthcare professionals while she is in the hospital, in aiding her treatments in decision making and providing comfort. And also, the patient frequently receives visits from her relatives who show her love and care. Therefore, the patient is relaxed and interacts with healthcare professionals, well supported, and is happy. So, the coping, the sexually reproductive pattern. I am currently widowed and sexually inactive, patient H states, because her husband is missing. During hospitalization, I am sexually inactive because my husband is missing, and they yearned for an intimate relationship at times. Therefore, patient H was able to deal with her situation, but she hopes to find a partner soon after she discharged. So the coping stress tolerance pattern, that the patient appears to be irritable and annoyed, concerned that she feels cold even in the summer, she has no appetite, therefore she is gaining weight. And according to patient H, she is worried and anxious about her hair loss. So during the hospitalization, the patient's nurse assists the patient in engaging in stress coping mechanisms in order to improve mental health. And while undergoing the coping stress management strategy, the patient appears to be less anxious and scared. So, coping stress mechanism is defined as the mobilization of thoughts and behaviors to manage internal and external stressful situations. So that is according to Algorani 2020. Next. Lastly, in the patterns of functional health, values, belief pattern. Patient H religion is Roman Catholic and she attends church on a regular basis. During hospitalization, patient H claims that she never blames God for her condition and the patient's relationship with God remained unchanged. So therefore, patient is religion affiliated and her faith with God becomes more stronger. Next is the patient age activity daily living. So the activities are bathing, dressing, toileting, transferring continence, and feeding. So in bathing, the score is 1, meaning she is independent. So in dressing, she is dependent, means that she needs help in dressing herself, as upon the admission she was mental impaired. And toileting, independence, 1 point, transferring, 1 point, independence, continence, 0 points for dependence that needs supervision in assisting total care in bowel or bladder. Then the feeding is independence, scored 1. So the total points is 4. So the interpretation is that the client is experiencing moderate impairment.
So, good day. Today I'm going to discuss physical assessment. So, for the posture and gait of the patient may appear slouching because this is due to the patient being lethargic. And for the weight of the patient, she may appear to have gained weight because hypothyroidism causes low metabolism. For signs of distress, she has dull facial expression. This is due to drop in hormone production. For effect of mood, the patient appears to have a change in personality, is lethargic, and appears to have intellectual impairment because this is due to drop in hormone production. For speech, the patient's speech may become slow because voice and speech changes may occur due to hypothyroidism. Next. For the skin of the patient, it is dry and scaly because this is due due to decreased eccrine gland secretion and cold to touch. This is because hypothyroidism slows metabolism, which makes body temperature drop. And the patient may have pale skin because of the dermal mucopolysaccharides and dermal water content. For the nails, it may be brittle due to decrease in thyroid hormones. For hair and scalp, the hair is dry and sparse hair or has hair loss. This is due to drop in hormone production. For the face is pale because of the dermal because of the dermal mucopolysaccharides and dermal water content, and has puffiness of the face due to inadequate production of thyroid hormones, and has periorbital swelling because hypothyroidism can cause fluid retention in the body, including around the eyes. For the eyes, the patient has droopy eyelids due to inadequate production of thyroid hormone. Next. For the neck, the patient may appear to have enlarged thyroid. Uh, an underactive thyroid can cause enlarged thyroid gland. Um, the patient has bradycardia with 60 beats per minute. In hypothyroidism, the reduced level of thyroid hormone causes the heart muscle to pump less vigorously and eventually become weakened. For the abdomen, the patient has abdominal distension and is constipated due to impaired esophageal motility and gastric emptying, and has abdominal discomfort due to her constipation. And for the upper and lower extremities, the patient appears to be weak um, due to the patient being lethargic. Next.
And for the diagnostic test and laboratory studies, patient H was admitted in the hospital on April 10, 2021. She underwent a diagnostic examination, which is thyroid stimulating hormone test, and her diagnostic examination resulted hypothyroidism, and the interpretation was the output of thyroid hormones from the thyroid gland did not increase. She also took various tests such as CBC or complete blood count and CMP or comprehensive metabolic panel. So under CBC, she had an abnormal result in lymphocytes. The the result was 60%. The normal range is 14 to 46%. So the interpretation was above normal range. Next is T4. So the result is 3 micrograms per deciliter, and the normal range is 4 to 12 micrograms per deciliter, and the interpretation was below normal range. Next is T3 or thyroxine 3. The result was 0.14 nanogram per deciliter. The normal range of T3 is 75 to 195 nanogram per deciliter. So the interpretation was below normal range. And next is free T4 or free thyroxine 4. The result was 0.6 nanogram per deciliter. The normal range of FT4 is 0.9 to 2.3 nanogram per deciliter. So the interpretation was below normal range. Next is FT3 or free thyroxine 3. The result was 0.01 nanogram per deciliter. The normal range of FT3 is 0.2 to 0.5 nanogram per deciliter. And the interpretation was below normal range. Last in the CBC is TSH. So the result of her TSH was 10 microinternational unit per liter. The normal range of TSH is 0.4 to 4.0 microinternational unit per liter. So the interpretation was high TSH levels. So next is CMP, or Comprehensive Metabolic Panel. So under CMP, she had an abnormal result in glucose. So the result was 160 milligrams per deciliter. The normal range is less than 140 milligrams per deciliter. So the interpretation was above normal range. Next is in creatinine. She had a result of 6 milligrams. The normal range of creatinine is 0.84 to 1.21 milligrams. So the result was above normal range. Next is sodium. The result was 128 milliequivalent per liter. The normal range is 135 to 145 milliequivalent per liter. The interpretation was below normal range. Next is potassium. The result was 3 millimoles. The normal range of potassium is 3.6 to 5.2 millimoles per liter. So the interpretation was below normal range. And last but not the least, chloride. The result was 80 milliequivalents per liter, and the normal range of chloride is 96 to 106 milliequivalent per liter. So the interpretation was below normal range. And lastly, carbon dioxide. The result was 21 milliequivalent per liter. The normal range of carbon dioxide is 23 to 29 milliequivalent per liter. So the interpretation was below normal range. So next, for the medications, IV infusions, blood transfusions, and treatment given, here are the recommended medications for hypothyroidism. These drugs are suitable treatment for patient H. So first is levothyroxine. The dose and route of this drug is 50 to 60 micrograms equals approximately 60 milligrams or 1 grain. And it will be given orally. The mechanism of action of levothyroxine, it increases the basal metabolic rate or BMR of carbohydrates, fats, and proteins. It is also involved in the regulation and differentiation of cell growth. It is indicated as replacement therapy in hypothyroidism. Its adverse effects are nervousness, excitability, tremor, muscle weakness, cramps, sweating, flushing, heat intolerance, headache, insomnia, tachycardia, palpitation, angina, and etc. And it is contraindicated to untreated hyperthyroidism, uncorrected adrenal failure, or recent MI or myocardial infarction. And the nursing responsibility for levothyroxine are monitor response carefully at start of the therapy and adjust dosage. Ensure that patient swallows tablet with a full glass of water. Do not change brands of T4 products. Do not add IV doses to other IV fluids. Use caution in patients with CV disease, and administer oral drugs a single daily dose before breakfast with a full glass of water, and arrange for regular periodic blood test of thyroid function. Next is Euthyrox. It is a trade name for levothyroxine. The dose and route of this drug is 25 to 150 micrograms, and it will be given orally. The mechanism of action of Euthyrox contains the active ingredient levothyroxine, a synthetic crystalline levothyroxine or T4 in sodium salt form. It is indicated as treatment of benign euthyroid goiter in the patients with normal thyroid function, prophylaxis of relapse after surgery for euthyroid goiter, depending on the post-operative hormone status, and it is substitute therapy in hypothyroidism. And its adverse effects are confusion, disorientation, fast or weak pulse, lightheadedness, loss of consciousness, loss of coordination, and slurring of speech, difficulty breathing, swelling of face, lips, tongue, or throat, chest pain, little or no urination, difficulty swallowing, and dilated neck veins. Euthyrox is not indicated for suppression of benign thyroid nodules and non-toxic diffuse goiter in iodine-sufficient patients. The nursing responsibility for this drug is monitor serum TSH levels after an interval of 6 to 8 weeks after any change in dose. Next is liothyronine or Cytomel. The dose and route of this drug is 25 micrograms per day, and it will be given orally as well. The mechanism of action of this drug is replacement of or supplementation to endogenous thyroid hormones. Principal effects is increasing metabolic rate of body tissues, promote gluconeogenesis, increase utilization and mobilization of glycogen stores, stimulates protein synthesis, promotes cell growth and differentiation, and aid in the development of the brain and CNS. Its adverse effect, it is indicated as thyroid supplementation on hypothyroidism. Its adverse effects on central nervous system are insomnia, irritability, headache, in cardiovascular, arrhythmias, tachycardia, angina pectoris, in gastrointestinal, abdominal cramps, diarrhea, vomiting, dermatologic, hyperhidrosis, endocrinologic, hyperthyroidism, metabolic weight loss, heat intolerance, and in musculoskeletal accelerated bone maturation. And this drug is contraindicated in hypersensitivity and recent MI and hyperthyroidism. The nursing responsibility for this drug are assess apical pulse and BP, monitor thyroid function, monitor blood and urine glucose. Next is Liotrix or yung Tyrolar. So the dose and route of this drug is 1 tab of Tyrolar daily. And it will be given orally. Mechanism of action, natural thyroid hormone, increases basal metabolic rate, increases utilization and mobilization of glycogen store, promotes gluconeogenesis. It is indicated as Hashimoto's thyroiditis, congenital hypothyroidism, goiter treatment, and agent in a differential diagnosis of hyperthyroidism. Its adverse effects are arrhythmias, increased blood pressure, headache, tachycardia, tremor, increased appetite, and diarrhea. And it is contraindicated to hypersensitivity to thyroid hormone, acute MI, and treatment of obesity. The nursing responsibility is watch for possible additive effects, note metabolic effects of plyotrix, and monitor diabetics for glycemic control. And lastly, Westroid. The dose and route of this drug is 32.5 mg or milligrams, and it will be given orally. The mechanism of action increases the metabolic rate of body tissues. It is indicated as replacement of supplemental therapy in patients with hypothyroidism. Its adverse effect or adverse reactions other than those indicative of hyperthyroidism because of therapeutic overdosage, either initially or during the maintenance period, are rare and contraindicated in patients with thyroid disorder called thyrotoxicosis. And the nursing responsibility for this drug is monitor patient for dehydration and institute remedial measures promptly. Next.
So, for the review of systems, in general, the patient appears to have a change in personality, has evidence of intellectual impairment, is lethargic, has dull facial expression, and appears to be weak. Next is integumentary. The patient has no rashes, no itchiness, and no jaundice, has dry, scaly skin, cold to touch, and skin appears to be pale. For HEENT, the head, no headache, has periorbital swelling, has puffiness of the face, and face is pale. For the eyes, no blurring of vision, pain and discharge, but has droopy eyelids. For the ears, no aching of ear or no tinnitus. Nose, no allergies nor sneezing. Throat, may appear to have enlarged thyroid. Next is respiratory, no presence of cough and colds nor difficulty of breathing which is normal. For the cardiovascular, the patient appears to have bradycardia and has clear S1 and S2 heart sounds. For gastrointestinal, the patient has constipation, has abdominal discomfort, and has abdominal distension. Next is genitourinary. The patient has no dysuria, nocturia, and hematuria. Next is reproductive. The patient's breast has no pain nor soreness and no sexually transmitted disease. And last is musculoskeletal. The patient appears to be weak. Next.
For anatomy and physiology, hyoid bone. It is a U-shaped bone located at the anterior midline of the neck. It allows a wider range of tongue, pharyngeal, and laryngeal movements by bracing these structures alongside each other in order to produce variation. Thyroid cartilage, located at the front wall of the larynx. Its main function is to protect the vocal folds which located behind the ear. It is also changes the pitch of the human voice. Superior thyroid artery. Superior thyroid artery is a major blood vessel that supplies oxygenated blood to the thyroid glands and larynx. Isthmus of the thyroid glands. It connects the two lobes of the thyroid glands located on either side of the windpipe in front of the neck. Common carotid artery. This provides main blood supplies to the neck and head. It supplies blood to the neck and face. Trachea, also known as the windpipe, is part of the airway system. It carries carbon dioxide and gas waste from your lungs. Next is pathophysiology. Hypothyroidism, where there is an increased thyroid stimulating immunoglobulin thyroid neoplasm excess TSH. Hypothyroidism symptoms are decreased basal metabolic rate, weight gain, cold sensitivity, and decreased cardiac output.
So for the section number 10, prioritize list of nursing problems. The priority is the risk for decreased cardiac output due to decreased heart rate as evidenced by 60 beats per minute and a blood pressure of 90/70. For the number 2 priority is the imbalanced nutrition, more than body requirement related to greater intake than metabolic needs as evidenced by weight gain. Lastly, disturb body image related to signs and symptoms of hypothyroidism as evidenced by verbalization of negative feelings towards body. Next is the nursing care plan. So, for the assessment, the, the patient verbalized that tumataba ako kahit 2 beses lang ako sa isang araw kumakain. Ang pangit-pangit ko na, nahihiya akong lumabas ng bahay. And the objective data, vital signs are as taken. Blood pressure of 90/70, respiratory rate per minute, temperature of 36 degrees Celsius. Weight gain is 15% for the last month. Weight before was 95 kilogram and weight now is 130 kilogram. The patient is lethargic, has hair loss, dull facial expression, droopy eyelids, puffiness of the face, dry sparse hair, fatigue, dry skin, amenorrhea, and decreased libido. So for our number 1 diagnosis for the risk for decreased cardiac output, the plan is the client will demonstrate adequate cardiac output as evidenced by blood pressure and pulse rate with optimal parameters for patient. For the intervention, note the skin color, temperature, and moisture because cold, clammy, and pale skin is secondary to compensatory increased and sympathetic nervous system stimulation and low cardiac output and oxygen desaturation. Check for any alteration in levels of consciousness. Decreased cerebral perfusion and hypoxia are reflected in irritability, restlessness, and difficulty concentrating. Aged patients are particularly susceptible to reduced perfusion. Assessed heart rate and blood pressure. Most patients have compensatory tachycardia and significantly low blood pressure in response to reduced cardiac output. Check for peripheral pulses, including capillary refill. Weak pulses are present in reduced stroke volume and cardiac output. Capillary refill is sometimes low or absent. Inspect fluid balance and weight gain. Weigh client regularly prior to breakfast. Check for pedal, and sacral edema. This is because compromised regulatory mechanism may result in fluid and sodium retention. Body weight is a more sensitive indication of fluid or sodium retention than intake and output. Lastly, record urine to determine how often the patient urinates because the renal system counterbalances low blood pressure by retaining water. Oleuria is a classic sign of decreased renal perfusion. And for evaluation, the goal was met. For our second nursing care plan, next please. Okay. For the second nursing case plan with the same assessment and same problem and objective data, for the diagnosis is imbalanced nutrition more than the body requirement related to greater intake than metabolic needs as evidenced by weight gain. The plan for the patient is the client will maintain a stable weight and will take necessary nutrients. For the intervention, assess client's weight due to excess fluid volume and low basal metabolic rate. Client with hypothyroidism experience weight gain and difficulty losing weight. Assess client's appetite. Client with hypothyroidism have decreased appetite. Provide a food diary for client. Looking into a client's food intake over 24 hours will provide a baseline for an individualized nutritional plan. Educate the client regarding body weight changes and hypothyroidism. Teaching the client and family will make them understand the opposite relationship between appetite and weight gain in hypothyroidism. Collaborate with the dietitian to determine the client's caloric needs. The dietitian can create the appropriate caloric requirements to maintain the nutrients intake and achieve stable weight. Encourage client to eat 6 small meals throughout the day. This will make sure the client has an adequate intake of nutrients and the client will with decreased energy levels. Encourage the intake of foods rich in fiber, low cholesterol, low calorie, low saturated fat diet. Hypothyroidism can cause constipation. When thyroid hormones levels are low, the body doesn't break down and remove bad cholesterol as efficiently as usual. For the evaluation, the goal was met. Next, please. Okay. For the last nursing intervention, with the same subjective data and objective findings, and for the diagnosis, disturbed body image related to signs and symptoms of hypothyroidism, as evidenced by verbalization of negative feelings towards the body. The plan for the client will verbalize acceptance of self in situation. For the intervention, assess causative or contributing factors to discuss the pathophysiology and signs and symptoms of disease to patient. Also, observe interaction of client with significant others or significant other because distortion in body image may be unconsciously reinforced by family members and or secondary gain or issue may interfere with progress. Third is determine coping abilities and skills. Listen to clients' comments and responses to the situation. Different situations are upsetting to different people, depending on the individual's coping skill and past experiences. Assess client and significant other to deal with or accept issues of self-concept related to body image. This will provide opportunities for listening to concerns and questions. Lastly, as nurses, we should promote wellness to provide early or ongoing sources of support, provide information at client's level of acceptance and in a small pieces to allow easier assimilation, accumulate clients' need, and support independence. For the evaluation, all the said intervention, at the end, it was goal met. Thank you.
So lastly, for patient age discharge plan, medication. So the patient's medication is called thyroid hormone replacement tablet or the levothyroxine helps bring your thyroid hormone level back to normal. Administer prescribed medication. Levothyroxine helps bring your thyroid hormone level back to normal. So take your medicine the same time every day and educate the patient about the side effects of levothyroxine such as weight loss and anxiety. So do not take extra doses of your thyroid medicine. It will not help you get better any faster and it may cause side effects. Those side effects are termed as over and underdose of medications. If you forget to take a dose, do not take a double dose of medicine. Take your usual dose the next day. So keep your pills in a container that is labeled with the days of the week. This will help you remember if you have taken your medicine each day. Next. So take your medicine with a full glass of water. Take it at least one before you eat breakfast or at bedtime at least 3 hours after eating. So do not take calcium or iron within 4 hours of taking your thyroid medicine because calcium and iron may intervene the effectiveness of the thyroid hormone. So and ask your healthcare provider about taking other medicines with your thyroid pill and always alert your healthcare providers of medications you are taking. So your healthcare provider will regularly check your dose is changed or you will usually have lab work in 4 to 6 weeks to be sure that the new dose is right for you. Next, so the exercise. Start slow or with a 5 to 15-minute walk each day and try to work up to 10,000 steps or 3 to 20-minute walks each day and get enough sleep. So the treatment for patient H is called thyroid hormone replacement, levothyroxine tablet. So the health teaching the patient and family requires information and instructions that will enable them to monitor the patient, which is patient age, condition, and response to the therapy. So the nurse provides written instructions and guidelines for the patient and family regarding patient age condition and avoid and discourage use of external heat source as the side effect of taking levothyroxine. Example, heating pads, electric or warming blankets. Next, so outpatient, follow up with the healthcare provider or as advised. Call the healthcare provider right away if you have any of the following: chest pain, puffy hands, face or feet, regular heartbeat, confusion, and also explain the necessity for long-term follow-up to patient and family. Next, so the diet for the patient is talking with the registered dietitian about the diets of a healthy lifestyle. So inform patient about the importance of having a good diet for treating her disease. Eating nutritious and balanced diet such as high fiber which helps relieve constipation, low calorie diet and maintain a healthy weight. So avoid taking nicotine, caffeine, alcohols and carbonated liquids with also processed foods. So encourage the client to consume fluids, instruct client to consume low-fat diets, foods, and instruct patients about foods with high water content. Also avoiding foods such as soybean flour, cottonseed meal, walnuts, and dietary fiber, calcium, and calcium fortified juices. Next, So for the sexuality and spirituality of patient H, sexuality is addressed sexual orientation and preferences, decreased libido and sexual function, and the variety of sexual urge. So the spirituality is that patient was instructed to communicate with God by praying and asking for guidance, good health, and strength at all times. And also, don't forget to thank for all of his good deeds. And that's all. Thank you.